Welcome to today's webinar titled Prepare for First Annual TRICARE Open Season Now. We are thrilled to have with us today Mark Ellis, Senior Health Program Analyst, TRICARE Policy and Benefits Office with the Defense Health Agency. Without further delay, I will turn things over to Mark Ellis.
Thanks, Dan. Hi, this is Mark Ellis at the Defense Health Agency. I have with me several of my other colleagues who may chime in and they'll announce themselves as they go along. So thank you for joining this webinar. We are excited to present some information about the first ever annual TRICARE Open Season enrollment period. But before I do that, I need to read the disclaimer on slide number 2. So the appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or service contained therein. For other than authorized activities such as military exchanges, morale, welfare, and recreation sites, the DoD does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this DoD-sponsored website. All right, I got through the disclaimer. Here's the real scoop. So the web addresses that you'll see in our slides and the ones that I read out are trusted DoD or federal websites where we would like you to go to get detailed information about the TRICARE benefit, and for one particular website, the upcoming federal employee vision and dental program, commonly called FedVIP. All right, slide number 3. Let me tell you what I'm going to tell you about. That's the standard sort of presentation for military briefers. So I'm going to talk about what the open season is, how the TRICARE Open Season differs from the FedVIP Open Season, and I'm going to tell you about what your options are through the open season and other things about that in our policies. I want you to remember one thing if you remember nothing out from this presentation. If you and your family members are currently enrolled in TRICARE Prime or TRICARE Select, and you like that coverage, and you don't want to make any changes to the coverage you're currently enrolled in, do nothing. Don't call the contractor. Don't go to a website to our online enrollment system. If you are totally happy with your current coverage, either TRICARE Prime or TRICARE Select, do nothing during the open season. I'm going to say that a couple more times along the way. So on slide number 4, let's actually talk about what open season is. So in the National Defense Authorization Act in 2017, the department was directed to implement an annual enrollment period and also opportunities where you can elect to make a change to your coverage once a year for coverage that begins then on the following 1st of January, or else you can make an election to change your coverage that you currently have or you don't have but you'd like to enroll if you have a qualifying life event. I'm going to explain those terms in a little bit, but the fact of the matter of it is what Congress directed us to do in 2017 is exactly what the rest of America does with commercial health insurance. When you first join your employer, you get a stated period where you get an opportunity to enroll in employer-sponsored coverage. And then once you do that, if you have changes to your family composition or changes to your employment or something like that, you have an opportunity to add or change your coverage at that time. So we're doing nothing more than what the commercial coverages have done for decades. All right? So TRICARE Open Season is the annual period where you can roll in or change your TRICARE coverage, TRICARE Prime, or TRICARE Select for the following year. It'll happen from the Monday of the second full week in November to the Monday of the second full week in December. Sounds like a mouthful. Please don't try and remember that. But every year we're going to put it out. This year, the open season for TRICARE enrollment will be November 12th to December 10th. And that coverage, if you make a change, either enroll in or make a change to your TRICARE Prime or TRICARE Select coverage, that coverage will be effective on 1 January 2019. So going on to the next slide, slide number 5. How does the TRICARE Open Season differ from the federal benefits open season? So I should tell you what the Fed part of it is. So again, several years ago, the department was directed and given the authority to partner with the Office of Personnel and Management. That's the federal agency that provides the federal benefit to federal employees and their family members, their employer-sponsored coverage. And so the department was directed to terminate the TRICARE Retiree Dental Program effective the 31st of December 2018, and eligible retirees and their family members, survivors, and Medal of Honor recipients and their family members, if they choose to have dental insurance, they can instead sign up with OPM's FedBIP program for dental coverage. The good news is that coverage for our TRICARE Retiree Dental Program, we had one plan that was available worldwide. With the FedBIP Dental, there's 10 plans available worldwide. Some may not all be offered in your particular area, but usually here in the continental United States, you'll probably get 3 or 4 of the 10. In some cases here in the national capital area, all 10 are offered to military beneficiaries. So, and also, we were directed to OPM and DoD were directed to open the FedBIP Vision Plan, which covers eye exams and contact lenses and frames and lenses and spectacles and such under an insurance plan that's currently offered to federal employees. So, long story of that, they have their own open season. It's the same date, 12 November to 10 December, but the enrollment for the retirees into the dental FedBIP and for most eligible beneficiaries, DoD eligible beneficiaries who want to purchase the vision coverage, they have to contact OPM's enrollment contractor, not TRICARE, right? And so there's a web address there, tricare.benefeds.com. That is the website where you can go to get information. Currently, the information is available for you to review the 2019 plans that are being offered for both vision and dental, along with the premiums that are to be charged for those plans. We really recommend they have a really good tool there where you can compare coverages through the various plans, as well as the premiums. And the other thing, for the dental in particular, you should take the list of what's being offered in your area to your local dentist and say, hey, do you take FedBIP? If so, which of the plans do you take? Because your dentist may not take all of them, okay? And so the same is true for the vision plan. Look at the provider list to make sure the vision providers in your area are listed and are available in your area. So FedBIP open season is the same dates, but if you want the FedBIP dental for retiree families or for the vision coverage, you have to contact OPM's enrollment contractor. The website's there. On the other hand, TRICARE open season, you'll need to contact the enrolling contractor in your region. So here in the continental United States, it's Humana in the East region, Health Net Federal Services in the West. Overseas is International SOS, and also we have the 6 Uniformed Services Family Health Plans in designated areas here in the United States. That applies to anybody who is eligible to be enrolled in TRICARE Prime or TRICARE Select. That's managed by the Defense Health Agency, and again, you'll contact your regional contractor to elect your coverage. To get more information about TRICARE Open Season, tricare.mil/open season is the one-stop shopping web address for you to get all the information that you need beyond what I'm going to tell you today. So on the next slide, we just want to make sure you mark your calendar. If indeed you want to make coverage changes for the TRICARE Prime or Select coverage you're currently enrolled in, the 12th of November through the 10th of December is the open season time for TRICARE plans. On slide number 7, let's talk about what the options are. So as I said earlier, and I'm going to repeat it again and again, if you like sort of like what President Obama maybe went to say when back in the Affordable Care Act, but if you like your current TRICARE coverage, TRICARE Prime or TRICARE Select, and that's the coverage you want to have going forward in 2019, do nothing. We're going to automatically enroll you or continue the coverage that you currently have for another year, right? Because when you say that you want to have this coverage, the coverage that you say you want, if you say do nothing, we're going to roll you in, but that is the coverage that you will have for 2019, calendar year 2019, unless you have a qualifying life event, and I'm going to talk about that in a little bit. So first thing you could do is say nothing, and you're just going to stay in that coverage for 2019 until you stop paying your enrollment fees or you become ineligible for that benefit. Another option you have is if you're eligible and you're not currently enrolled, this be the time to elect to enroll so you have coverage beginning on the 1st of January 2019. And then finally, you can elect to change your plans. You can change from a TRICARE Prime plan to a TRICARE Select plan. These are still dependent upon the type of beneficiary you are. So if you're a retired member or a retiree family member, you can only switch from a Prime retiree plan to a TRICARE Select retiree plan. Alternatively, if you're an active duty family member, you can switch from a TRICARE Prime active duty family member plan to a TRICARE Select active duty family member plan, or vice versa, right? You can also switch from individual coverage to family coverage. That really, for the most part, really only applies to our retiree family members who must pay either an individual enrollment fee for TRICARE Prime or a family fee for TRICARE Prime. All right, let's move on. So slide number 8 says clearly, TRICARE Open Season doesn't apply to the premium-based plans. So let me tell you what those are. So we have certain plans where beneficiaries must pay monthly premiums that for the most part cover the full cost of the care in some instances. So TRICARE Retired Reserve is for selected reserve members and their family members who were the members not called to active duty. TRICARE Retired Reserve is for retired reserve members who are under the age of 60. And then finally, TRICARE Young Adult is for those children who have aged out at either age 21 or up to age 23, and they purchase a premium-based coverage called TRICARE Young Adult. We also have the Continued Health Benefit Program. That is for folks who lose all their eligibility to have TRICARE, and this is what it's a COBRA-like coverage. What that means is it's a continuation coverage. You lost all TRICARE eligibility. You can purchase CHCBP coverage for a stated period of time so you can transition to something in the private sector. And then finally, it's listed here as such, but TRICARE for Life doesn't require premiums paid to the Department of Defense. It likely requires premiums to be paid for Medicare Part B to the Social Security Administration, but for those that become eligible for TRICARE for Life, that is an automatic entitlement that we turn on in our eligibility database called DEERS whenever Social Security Administration tells us that you're eligible for Part A and you are either paying Part B premiums or in certain situations you're waived from paying Part B premiums. For TRR, TRS, TIA, and CHCBP, you can enroll in those plans at any time. We call that continuous open enrollment. So if you become eligible for one of our premium plans, you don't need to wait for open season to enroll. You can do that any time that you become qualified for them. All right, let's move on to slide number 9. So let's go through a couple scenarios about if you're thinking about changing plans during the TRICARE Open season. If you're a particular type of beneficiary, what are your options? So if you're an active duty service member, active duty service members, well, whether you fill out an application or not, we consider you to be in TRICARE Prime. And until you retire, the only thing that's available to you is one of our TRICARE plans, either Prime if you're near a military treatment facility, or TRICARE Prime Remote because you're more than 50 miles away and meet other criteria. Bottom line answer for active duty service members, Prime, Prime, Prime. Right. Active duty family members, you can change during the open season. You can elect to enroll in a change to Prime from Select and Select to Prime. The thing about Prime, though, is if you elect to change from Select to Prime and you live near a military treatment facility, mostly all of our active military installations, if you elect to enroll and change from Select to Prime, you may, if you want Prime, you may have to be seen a PCM at a local military hospital. There are geographic limitations to be in Prime. You can actually waive the drive time standards beyond 1 hour of, 30 minutes for primary care. But in general, if you want to switch to Prime and you live near an active military installation, you may have to have a PCM at the local military treatment facility, and you can also waive the drive time standards for that. And again, for open season doesn't apply to anybody who is eligible to enroll in TRICARE Young Adult. Let's talk about reserve component members or family members that are eligible for or enrolled in TRICARE Reserve Select. Again, this is a premium-based plan during open season. Don't need to do anything. You can elect to enroll in or terminate your TRICARE Reserve Select coverage whenever you desire. And if you choose to terminate your coverage, there is a lockout period after that of 12 months. Same is true for retired reserve, eligible for or enrolled in TRICARE Reserve Select. These are retired reserve members. They're commonly called gray area reservists who have retired from the selected reserve, but they haven't hit age 60 where their normal TRICARE benefits kick in, and so they too can purchase premium-based coverage up to age 60. Again, for the folks, the retired reserve members, they can enroll at any time. It's a premium plan. Retirees, that are eligible to enroll in Prime or Select, you can elect to change your coverage at any time during the open season. Again, this coverage will start on 1 January. You can switch from Prime to Select. And again, if you live near a military installation, you may be required to have a primary care manager at the local MTF. By the way, our policy on that is having military beneficiaries enrolled to local military hospitals and clinics helps us support the readiness of our force by ensuring we have a patient population that are military and civilian doctors, nurses, and technicians can maintain their skills so we can support what the nation calls them to do should they be deployed at the direction of the president. So we appreciate if indeed that you sign up for Prime and you have a PCM, we appreciate that you may need to go to the MTF. So and then again, TRICARE for Life, that open season does not apply to TRICARE. The TRICARE open season does not apply to those with TRICARE for Life. So for those that may be a little bit concerned about, Mark, what's TRICARE Prime, what's TRICARE Select? Let's go to slide 10 and we'll figure it out together. So TRICARE Prime is what we typically look at as a health maintenance organization or an option or a managed care plan option. You get most of your care provided by your primary care manager, and then he or she arranges for any other care that you might need. There is some prior authorization that are needed for some services. If you need a specialty service and it's available within the military treatment facility, a military hospital or clinic, your PCM will make a referral and they will offer you care at a military treatment facility. If that care is not available at the military hospital or clinic, you'll be referred to the network. There are some requirements where that care needs to be authorized. And if you don't get an authorization for that care, you could have a greater out-of-pocket expense. So generally speaking, TRICARE Prime beneficiaries must get their care from an established network of doctors or other healthcare providers. That could be at a military treatment facility, or it could be from a civilian provider in the network in your local area. No deductible applies. There are co-payment applies for beneficiaries, active duty service members. DOD's on the hook to pay for all their care, so there's never a co-payment for active duty service members. So that covers our managed care option. So let's talk about TRICARE Select. TRICARE Select is a preferred provider option. It's a PPO, preferred provider option style plan. Basically, you get space available care at a local military hospital if you like. Remember, the priority for care for people that get seen in the military hospitals and clinics are those who enroll in Prime. But if there's room at the inn, so to speak, under TRICARE Select, you may get a space available appointment at a military treatment facility. Otherwise, you can go downtown and see any civilian provider as long as they're TRICARE authorized. What does that mean? Well, what that means is TRICARE and our contractors, we want to make sure that you're seeing somebody who actually says who he or she is. So we want to make sure some simple things. One, they actually are licensed to provide medicine or other services in the specialty that's on their license or degree, right? And number two, they must have liability insurance to protect you. And if they're a network provider, then they also have to agree to abide by the access to care standard for our TRICARE Prime beneficiaries. So anybody who's TRICARE authorized is TRICARE Select, you can see. By the way, if you want to see a civilian provider and they're not TRICARE authorized, on the TRICARE.mil website, you can go there and there's a downloadable handout you can give to your civilian providers to encourage them to become TRICARE authorized. All right. So referrals are not required for most of the services, medical services under TRICARE Select. We do have some prior authorizations, the same as for TRICARE Prime. Prior authorizations are typically where there is a complex medical condition. So one of the ones that we require prior authorization is if you're going to have a solid organ transplant, you're going to have a heart transplant, you're going to have a liver transplant. We want to make sure that that care is well coordinated. So there's certain services where we require that you must get prior authorization before the service is provided. That doesn't keep you from getting emergency care, by the way, but there's certain services that are planned that require pre-auth, right? And then again, you can receive care from any provider. If you see a network provider, generally speaking, your out-of-pocket expense is less. And generally speaking, if you see one who's just a TRICARE authorized provider and they're non-network, generally speaking, you'll pay a little bit more. And then deductibles and co-payments and cost shares apply for TRICARE Select. So those are the two differences. TRICARE Prime is a managed care option. You know in advance how much you're going to pay because there's no deductible and everything for retirees is a co-payment. Active duty family members, by the way, under Prime have no co-payment if they get a referral. TRICARE Prime requires a referral and an authorization when you get care downtown. TRICARE Select, you basically can see anybody that you want. You get basic care at the military treatment facilities if you can get an appointment. Otherwise, downtown, as long as they're a TRICARE authorized provider, you can see them. There's a little bit more out-of-pocket expense, but you pay that because you get freedom of choice. All right, so those are the two main differences. All right, so as you go through this process and are thinking about open season, we have a lot of information that's on the TRICARE.mil website. And when you go to the TRICARE.mil open season, you'll be led to a comparison tool that allows you to compare TRICARE Prime versus TRICARE Select. So it gives you a little bit more information and links to standardized handouts that our DHA communication folks have written at a very understandable level. And so if this is something that's a little bit unfamiliar to you, please, by all means, go to tricare.mil/open season, and there'll be a lot more information on the differences of the two plans, including out-of-pocket cost. What's the copayment for this? What's the cost share for that? All right, so I remember I said that open season is the annual election for coverage that's going to start on 1 January of the following year. However, things happen to us in our military lives, whether we're retirees or active duty or reserve component, where things change, and we may need to make a change in our health care coverage that we elected or rolled over. And so if that occurs, called a qualifying life event, you have 90 days from that date to elect to enroll a new family member. Say, for example, you have a newborn. You have 90 days from the date of the birth to determine what TRICARE health plan that new eligible beneficiary is going to be enrolled in. And that coverage starts as of the qualifying life event. Another example on the retiree side. So if you're an active duty sponsor and you retire, the date of your retirement is the qualifying life event date, and you have 90 days from the date of your retirement to elect to enroll in a retiree plan. Because when you retire from active duty, we terminate all your TRICARE coverage because you're no longer eligible to be enrolled in an active duty or an active duty family member TRICARE health plan. And so you must elect to enroll in either TRICARE Prime or TRICARE Select as a retiree if you want to have coverage. By the way, you know, if you choose not to have TRICARE coverage, the law now allows you to not have it. You just have to tell us that, either by not electing to enroll or disenrolling. If you do disenroll, you're back to only opportunity to enroll is during the annual open season. So you may go a full year with no TRICARE coverage, or you have to have another qualifying life event. So have a baby, but you got to wait 9 months typically for that. So that's a big change. So if one member of the family has a qualifying life event, we allow everybody in the family to elect to change their coverage. So if the family's enrolled in TRICARE Prime and the spouse has the wife has a baby, everybody can elect to change their coverage. Also, not everybody has to be in the same coverage. You can have some family members that are enrolled in TRICARE Prime, and you can have other family members that are enrolled in TRICARE Select. We often see this happen when the family member has very complex healthcare conditions and they need to see a lot of specialists, or they prefer to see a particular provider that may not be in the network. Typically, the administrative burden of getting all those appointments done without having to get a referral and authorization, or in some cases be told, sorry, we have that care available at the local military hospital. We're not going to allow you to go downtown to see the specialist of choice. That's a good time you want to think about enrolling that family member at least in TRICARE Select. So as I said, no matter when you initiate the enrollment, the time frame is you got to do it within 90 days of the QLE. We do allow an extra 30 days for bursts overseas to enroll in the overseas plan because we recognize that it may be a little bit more difficult for our families overseas to get a birth certificate or some sort of documentation that meets the Department of Defense documentation requirements to prove you have a new little one. All right, so we do give an extra 30 days for births overseas, but generally speaking, qualifying life events, and by the way, most of the qualifying life events likely will need to be documented in DEERS. What that means is whatever that qualifying life event is, let me go to the next slide and I'll talk about what those are, and then I'll talk about the documentation. So on slide 12, here's the military changes. Change in sponsor status that results in ineligibility to continue the coverage you're currently in. So I mentioned a good example going from active duty to retired status. You're no longer eligible to be in the active duty family member plans because guess what? The fees are different. The out-of-pocket expenses are different. Retirees, if you're an active duty member or family member on the call, and this is the first you heard it, retirees generally pay more out-of-pocket expenses for their TRICARE health plan than active duty family members. And that's by law. That's what Congress intended. For your service while you're on active duty, there's less out-of-pocket expenses for you as our active duty family members. Change in eligibility status. Some of our members are married to other military members. By law, the spouse and the children can be eligible family members underneath the other uniformed service member. And so this happens often when active duty members marry, but particularly when one member either separates or retires, the children get their enrollment into their TRICARE health plan where typically it makes financial sense. So generally speaking, if one sponsor, uniformed service sponsor, is retired and the other one is active duty, generally speaking, the retired uniformed service sponsor should be registered as a family member underneath the active duty sponsor, and all the eligible family members should be enrolled under the active duty member. It's your choice. By law, there's entitlement to TRICARE coverage under either of the uniformed service sponsor. The key point about this is you can no longer be enrolled in a TRICARE health plan under both sponsors. It's one or the other. You got to choose. And so there's some information on the TRICARE.mil website that will help you walk through that. But in general, it's usually a financial decision, or where in some cases where the family are geographically separated, what's available in that area, and whether or not they want to enroll in Prime or Select. Okay. We do occasionally have government-directed primary care manager changes where either the local military hospital has room at the inn and we'd like more people to come in. We may direct those that are currently enrolled with a primary care manager in the civilian, local civilian area, that we need more people at the military treatment facility, and that would mean you have a choice. You can accept the PCM assignment at the local military hospital, or you can choose to be enrolled in TRICARE Select. Conversely, the same is true if we're over-enrolled at a local military hospital and clinic. We will offer you the opportunity to enroll with a civilian PCM, or you may elect to enroll in TRICARE Select. We may direct a plan change. In certain situations, we have not done this yet, but we envision in the future, based on our modernization of the TRICARE plan, there may be situations where the base, for example, only offers care to active duty military members, in which case the whole reason we offer the TRICARE Prime program around military hospitals and clinics is to support military medical readiness. But if only the people there are active duty, we don't want to force people to go to just a primary care clinic. So in that case, we may in the future not offer TRICARE Prime in that area. If we do so, you'll be offered an opportunity to enroll with a PCM downtown, or again, elect to enroll in TRICARE Select if that meets your needs. So those are examples of military changes. Let's talk about family changes on slide number 13. So these are the things where you're either adding or subtracting in general people to your family, eligible family. So marriage, divorce, or annulment. That includes eligibility as a 2020 former spouse. If you don't want to know what I mean by that, TRICARE.mil, just type in 2020 and you'll figure it out. That means that there's been a divorce, but the former spouse is still entitled to TRICARE coverage. Birth or adoption of a child, or placement of a child in a court in a member's home. It also covers things like loss of sponsor or family eligibility due to age, eligibility for Medicare, separation from the military. Relocation to a new country or city, region. Basically, we're looking for a zip code change here in the continental United States. Overseas, we're looking that you've made a move from one base to another, generally speaking. But if that occurs, and the reason we say that the moves are important is because where you move, the plan that you're currently in may not be available where you're going. And so we need to offer you the opportunity to make a plan change, because what we offered you back where you were before may not be there where you're going. Gain or loss of other health insurance. That's an opportunity to either pick up TRICARE, re-enroll in TRICARE coverage, or drop it if you think your other health and your commercial insurance is going to meet your family's needs. Change in family composition. This is when you're moving beneficiaries coverage from one uniform service sponsor to another. So say you have two active duty sponsors, one retires, and as I said earlier, generally speaking, you want to change that enrollment to underneath the active duty sponsor. If both are retired, by the way, it still makes financial sense, because the catastrophic cap for all our beneficiaries is family. So if you leave two kids who are enrolled under one sponsor and two kids that are enrolled under the other, you're going to pay up to two separate catastrophic caps. And so it always makes sense. It always makes sense if there's dual eligibility, because there's two uniform service sponsors that are married, regardless if they're active duty or retired or whatever, is that to put everybody underneath one. All right, at least for eligibility purposes, because regardless if they're enrolled in Prime or Select, the family shares the catastrophic cap. And the catastrophic cap just means that when your out-of-pocket expenses reaches the cap, TRICARE for the rest of the calendar year pays 100% and you pay nothing, as long as you see a network provider or the provider agrees to accept the TRICARE okie dokie rate for that service. All right, so let's talk about how to enroll. On slide 14, how do you make an enrollment choice? One, you can go online. There's an online tool called Beneficiary Web Enrollment, or BWE. You see the web address there. BWE is not available overseas, but you'll need a logon and a password. That could be a DEAR single sign-on logon. You can go to the DS Logon website, and you can generally do that online to get a DS logon. It's called online proofing. Or alternatively, if you're a military member or a civil servant and you have a common access card, commonly called a CAC card, that works as well, as long as you have a computer that supports the CAC. Certainly, you can call your regional contractor for assistance. Generally, about 85% of enrollment transactions, if not a little higher, are done over the phone. And it's a pretty easy way to get it done, as long as you know a couple of things. One, you know what you want. I want to be in Prime or Select. Otherwise, you can ask them questions. DoD pays our contractors to answer any and all questions you have related to TRICARE, right? So you can do that. But generally speaking, during the TRICARE Open season, you should have gone to our website, read the materials, determine which plan they're on. And then if you have any lingering questions, by all means, ask them. And then you tell them what plan you're in. They'll validate the eligibility for you and your family members, and they'll do that over the phone. If you need to pay an enrollment fee, they'll take a credit card information or a debit card information over the phone. And that typically, everything that they need to do to get you set up for coverage change starting on 1 January 2019, it's pretty easy, right? Or you can mail in the enrollment form to the regional contractor. The TRICARE.mil/enroll has all the information I've just mentioned. But in general, if you like to have the comfort of talking to somebody and have them walking you through the options, and the other thing about calling them is, generally speaking, in most instances, they're going to complete the enrollment transaction while you're on the phone with them. One other thing about TRICARE Open season, this is our first time we've ever done this, right? But we know we've done a couple, we have a couple indicators of how this may go on the 12th of November. The first is in the past, as you've probably experienced when we transitioned from the three contractors here in the continental United States to the two contractors here in the United States, the call centers for the new East and West contractors were totally overwhelmed, all right? Because everybody was concerned, did I get dropped from TRICARE? So we sent out 4.1 million letters telling everybody you're still enrolled. So we think there might be a greater call volume in the first week or so. Also, in working with the Office of Personnel and Management, the friendly folks that are going to offer certain beneficiaries FedVIP dental and vision coverage, they tell us the first 3 days of the open enrollment period, and the last 3 days are just tough, and it's hard to get through, right? And so be patient during the first week or so, and don't wait forever. I mean, your election during the open season is for coverage that's going to start on 1 January. So if you're an early adopter, I'm all over that. But if you are, you might want to hit BWE as opposed to calling your regional contractor or the overseas contractor. Again, for the calling them, though, you get to ask questions and you get to talk to a live person. All right. So next slide, slide 15, preparing for the TRICARE changes. Do sign up for, as I said earlier, for a DoD self-service logon. If you don't have a common access card, this is the only way you can get into the beneficiary web enrollment. You will go to this site and it will prompt you to create a logon and password, and it will validate your identity. If you can answer some questions that are based on information that's in a commercial database that has information basically about your credit rating. And so it's called LexisNexis, and they'll ask you questions like, did you have a home mortgage with one of the companies listed? Did you have an address, 1728 Del Mira Drive? Was that one of your addresses? By the way, that's one of my addresses that I got wrong when I did online proofing because I couldn't remember because it was so long ago. And so if that fails, you can call and talk to the DEER support office. The link to the phone number is off of the identity management website there. You see on our slides. And please, please, please update DEERs with your updated contact information, your mailing address, your phone numbers, and if you opt in to give it to us, your email address. We are starting to use social media a lot more, particularly here in the continental United States with the two new contractors. They're using text, they're using other social media. And for example, here in the continental United States, they don't mail out explanation of benefits when your TRICARE claim has been processed. All those are available online at the contractor's website. So how do you get notified? You get an email that doesn't have any private information, but basically says your contractor has processed a claim, and if you'd like to know about that, go to the website, the contractor's website, log on, and then you can see all the details of that particular claim. So the contractors by their website have two ways you can log on. One is they can issue their own logon and password, which is unique to that website, or you can log on with a DS logon. It is likely once you log on with the DS logon, they're going to turn off the Humana or the HealthNet web's password. So know that if you use the DS logon once, that's what you have to keep using. And by the way, DS logons change every 120 days now. So we do want you to update DEERs, and we do want you to sign up to receive our updates and news releases. You see there our web address to sign up. Anytime we make a change to TRICARE benefits or announce the open season or anything like that, we'll send you a notice by email. Finally, on slide 16, there are online resources. The best one to know what's going on with TRICARE Changes is TRICARE.mil changes. You can see the other web addresses there that will allow you to know about what your TRICARE benefits are. TRICARE.mil in general is the place you want to go. Finally, the TRICARE Open season starts on the 12th of November, ends on the 10th of December for coverage beginning on 1 January 2019. So Stan, that's it. I'd like to hear from everybody else, and I know you got lots of questions for me.
Lots of questions, but only a little bit of time. So let's get started. The first question reads, I'm newly married and would like to enroll my spouse only in one of the dental and vision programs. I have my own dental and vision through a past employer. Can I enroll her as self?
So first, though, as a new beneficiary, you must register her in the DEARS database, number one. Right. And so I need to know whether it's a retiree or active duty sponsor. Did the questioner indicate which?
No, they didn't.
So between now and the end of the year, if it's an active duty family member, register the new spouse in DEARS and then contact the TRICARE dental contractor to enroll in active duty family member dental coverage because for active duty family members, the TRICARE dental program continues. Active duty family members are not eligible to enroll in the FEDVIP dental program. If it's a retired sponsor, you can elect to enroll for 1 month or 2 months to the end of December, but you might want to also, during the open season, again, register the new spouse in DEARS, and then during the FEDVIP open season, go to TRICAREbenefits.com, where you can find information on how to enroll for dental coverage starting on the 1st of January.
This is Francine, and I work in customer service. Whoever is the qualifying person that qualifies for TRICARE has to enroll as well. Self and somebody else and self.
So if a retiree, the retiree member has to enroll as well. One of the things I should mention, if you're a retiree and a federal employee already, and you already are enrolled in FEDVIP dental or vision, the premiums are exactly the same. And if you have an eligibility as a federal employee and you already have your spouse and children enrolled in FEDVIP dental and vision, makes absolutely no sense to switch over to what is an eligibility as a military beneficiary. In fact, if you attempt to do so and enroll in 2 plans, the FEDVIP contractor is going to say no. All right, next question.
Okay. As a provider, if a patient enrolls in another program, can we still bill TRICARE as well?
So if you're talking about if you go see a civilian provider and he or she chooses not to submit your TRICARE claims because they're a non-network provider, you can submit the claim and seek reimbursement. If you have other health insurance, the same is true. TRICARE, generally speaking, pays first, and your provider may ask you to submit a claim to TRICARE to pay what TRICARE would pay after the commercial insurance pays.
Right, and as a provider, the one thing that may be different is if you're seeing like an active duty family member that was Select before, and they did have like a copay under you, if and when they enroll in Prime, they would not. So yes, you'll still be billing TRICARE, but what they pay out of pocket would vary.
Yes, thanks.
Next question. Will that November 12th being Veterans Day affect open season on that day?
That's a good question. We're currently working through that. We know at least one of our contractors here in the continental United States is going to be open. We're working to see if the other contractors are. On the FEDVIP side, the OPM's enrolling contractor will be open on the 12th of November. So we'll put out more information as we validate what the other contractors are going to do. Thanks. That's a good question.
Okay, thank you. The next question reads, I signed up and my eligibility for dental started 2/1/18. If I need a crown, I had a 12-month waiting period. My question is, will my waiting period begin all over again because we are changing to this new way?
So, not the dental expert, so I'd like you to go to tricare.benefeds.com, and you'll need to look at the plan coverage of the dental coverage you're planning to purchase to determine that answer. Next.
Okay, next question. Is pregnancy a life event? Once a patient becomes pregnant, could they switch from Prime to Select?
The quick answer is any diagnosis is not a qualifying life event. Birth of a child, however, is a qualifying life event. So my general recommendation to those that are thinking of starting a family is to consider where you would like to deliver your child, right? And so if you have a preference to not deliver your baby in a military hospital, our general recommendation is to not enroll in TRICARE Prime, or to determine that based on your beneficiary category, you may not be offered a primary care manager at a local military hospital. But remember, the rules change and we may elect to pull you back. In general, if you have a preference as to where you would like to deliver your baby, your greatest freedom of choice is by enrolling in a TRICARE Select plan. Next question.
Does the enrollment period for TRICARE Prime or Select apply to TRICARE for Life, or is there only one Medicare linked plan offered?
So TRICARE for Life does not require enrollment in TRICARE Prime or TRICARE Select, although in certain situations, those who have TRICARE for Life, which is Medicare Part A and Part B, unless that's waived in very limited circumstances, under certain circumstances where you live and the age of the Medicare eligible, TRICARE eligible and beneficiary, you may enroll in Prime, but there's no requirement for open season for TRICARE for Life. Again, you're eligible for Part A, you have Part B, and you're entitled to TRICARE. We automatically turn on TRICARE for Life as entitlement. Don't have to fill out any forms with us. All we need to see, and we get the information directly from the Social Security Administration. What do you have to enroll in, generally speaking, to have TRICARE for Life? You have to enroll in Part B and pay your Part B premiums. That's done through the Social Security Administration, not through the regional contractors. Next question.
I'm retired Medicare age, but on TRICARE Prime U.S. Family Health Program user. I don't pay premiums on this program. Will my status change?
No. Next question.
Let's see. Next year, I will change to TRICARE for Life due to age 65 Medicare after I sign up, which will be before my husband military retired. Will I still be able to get prescriptions based on base when I'm on TRICARE for Life?
The answer is yes. Make sure you pay your Part B premiums. But yes, if the drug is normally available at the base pharmacy, yes, you can continue to fill your prescriptions at the local base. If they don't normally carry that drug, then you'll have to obtain fill that prescription at a local TRICARE network pharmacy or through the mail order. If it's a maintenance drug, you'll have to fill it through the mail order. Next question.
I have Delta Dental Insurance for many years through TRICARE now. So will this be canceled automatically, or do I need to cancel it effectively December 31st and then get to the new dental insurance?
Good question. Thank you. That's a great question. So for those currently enrolled in the TRICARE Retiree Dental Program that's currently offered by Delta Dental, that coverage will be terminated by the Department of Defense on the 31st of December 2018. There is no automatic conversion to FedVIP Dental. We will terminate the coverage because the contract ends on 31 December. you must contact OPM's FedVIP enrollment contractor, tricare.benefeds.com, to enroll in during the FedVIP open season to have your retiree dental insurance with one of the dental plans offered by FedVIP. Excellent question. Thank you.
Next question. I'm a recent widow of a retired active duty member. I'm enrolled in TRICARE Select, but noted that the enrollment ends in April 2019. Why?
So I suspect it's because that as the surviving spouse, that is the 3rd year anniversary of the death of your sponsor. And so currently, if that is true, the first 3 years after the death of your sponsor, you have active duty family member copays. At the 3-year anniversary, that coverage will be terminated and you must elect to enroll in a TRICARE retiree plan. That changes status, by the way, as a qualifying life event, right? So make sure 30, 60 days prior to the date of the 3rd anniversary of your husband's death that you contact the regional contractor or hit the website to elect to enroll in the TRICARE retiree health plan of your choice. If there's already children, they remain as active duty family members until they age out. Next question.
I'm currently enrolled in TRICARE Prime. I was told the MTFs have first right of refusal. However, I haven't used an MTF in over 10 years. I prefer to continue seeing my network UC health providers. The MTF recently accepted a refusal for surgery. How can I elect to stay with my current network provider in the future, which ensures continuity of care?
So that's called right of first refusal, and again, that supports the readiness that we need to have of beneficiaries that keep our doctors, nurses, and technicians skilled and proficient. And so, generally speaking, though, if you're getting care in the civilian sector and it's a true continuity of care issue that you've been seeing this particular provider, generally speaking, even if that service is available at the local military hospital or clinic, you can ask for a waiver to remain downtown. If, on the other hand, you've not been treated for this particular condition and that service is available at the base, you could have to go out to be seen at the local base hospital for that care, or you may elect to go point of service, which is a $300 deductible and 50% of the TRICARE Okie Dokie fee. The alternative is, if you fear that that's going to happen to you, TRICARE Select is a much better option because right of first refusal does not apply to those enrolled in TRICARE Select, and you can select any eligible TRICARE authorized provider. Next question.
This will be the last question since we are at the top of the hour. Does getting divorced from the current retired military member sponsor fall under qualifying life event?
Well, yes, yes, it does. That's a change in somebody's status, so the answer is yes. The question is, though, is for the former spouse whether or not they meet the conditions commonly called 2020. That is that the marriage was during 20 years of service, and the marriage lasted during that time period. If so, the unremarried former spouse who qualifies under 2020, they get 90 days to elect to enroll in a TRICARE retiree health plan. Otherwise, they're eligible to enroll in CHCBP because they've lost all their TRICARE entitlements. That also means, by the way, that those in the family may elect to change their coverage too, because remember, a change in status of a QLA in the family unit means everybody in the family household can elect to change.
Okay. Mark, I would like to thank you for presenting today's topic. I would also like to thank our attendees for participating in today's webinar. If you have questions after the webinar, or if we were unable to answer your questions today, please contact your TRICARE regional contractor. Also, many of the answers to questions about TRICARE benefit can be found on the TRICARE website at tricare.mil. This concludes today's webinar on Prepare for First Annual TRICARE Open Season Now. Thank you all for joining and have a great day.